Our final speaker this evening is Dr. Sanjiv Mathur, an anesthesiologist with an interest in cardioprotection and environmental medicine. Dr. Mathur will reflect on how his medical profession intersects with climate action, encouraging us all to make small changes that collectively make a big environmental impact. Welcome.
Tomorrow, April 22nd, is Earth Day. This should be a time to celebrate this planet, but unfortunately it's become a time where about 1 billion people have to demonstrate about protecting our Earth. I didn't need Earth Day in my family. My family focused on climate sciences regularly since my dad was a government environmental scientist and one of the pioneers of climate change in Canada. So naturally, I went off to university to study sciences, including ecology and the environment. But after 2 years, I decided I wanted a job. So I got rid of my Birkenstocks, grabbed a stethoscope, and I went off to medicine and studied to be an anesthesiologist. I came up to Sudbury in 1999 and was enjoying a great career. But in 2006, my life changed a bit. My wife and I went to go see the movie, The 2006 Inconvenient Truth, by Al Gore, the Nobel Prize winner. We watched this movie and we realized that very little had been accomplished on the global warming perspective. My wife and I left that movie quite distraught and disturbed, and like two responsible adults, we conceived another child. Several months later, when we were talking to this child in utero, on CBC, the IPCC report came out. The IPCC is the biggest gathering of climate experts in the world. And they stated that the future of our unborn child was now threatened. This disturbed us, of course. At that point, we made a commitment that we were going to do whatever it took to protect the life of our unborn child. My wife eventually gave up teaching and became an environmentalist. Well, what could I do as a physician, I wondered, in Sciences North? So I investigated. The World Health Organization claims that climate change is the greatest threat to global health in the 21st century. A powerful statement. Climate change is a health crisis, with direct deaths from disasters like floods, fires, and droughts, the resulting conflicts. There's an increase in diseases, including gastrointestinal infections. There's an increase in both heart and lung disease from heat stressors and air quality. There's, of course, food and water insecurities, as well as displacement, all these affecting directly human health. Médecins Sans Frontières, the Canadian Medical Association, and major health organizations implored physicians to look within our health practices to see what we could do to reduce our carbon footprint, since healthcare had a big chunk. So I decided to explore my own area of anesthesia. And to my surprise, I was significantly contributing to greenhouse gases every day. Anesthesia is amazing. We give you medications to make you unconscious. And once you're unconscious, we pump anesthetic gases into your lungs. They enter the bloodstream and float up to your brain. They go into your brain and basically put your brain into a sleep inactive mode so that you don't react to surgery. But at the end of the case, you blow all these gases off. You breathe them out. And eventually all these gases end up back in the atmosphere. No different than carbon dioxide, methane, and water. It travels up to the atmosphere and acts as a greenhouse gas. Unfortunately, the anesthetic gases that we use to keep you asleep are extremely potent greenhouse gases, one of them being over 2,500 times more efficient than carbon dioxide in radiating heat back to the earth. We use two main gases in the operating room, sevoflurane and desflurane. And to make it easy for you, safe sevoflurane and destructive desflurane. I did a lot of research and I showed a dramatic difference between using safe sevoflurane or destructive desflurane. If you did a full day of neurosurgery using sevoflurane, it would be equivalent in carbon footprint of getting into a car and driving 40 kilometers. If you did the same surgeries using destructive desflurane, it was equivalent to getting into a car and driving over 2,000 kilometers. That's one operating room, one surgeon anesthetist, one hospital. I presented this data to lots of different Canadian meetings, and I was proud to announce that Health Sciences North committed to stop using destructive desflurane in 2020. What impact did that have, just getting rid of destructive desflurane for 1 year? Well, imagine you take a car, small compact car, and you drive outside and you turn right on Ramsey Lake Road. The carbon footprint, you would say, would be equivalent of taking that car and driving it to the moon and back. And then you got to turn around and drive it to the moon again and back. You're not done yet. You'd have to drive it to the moon a third time and a fourth time, to the moon and back 4 times to equal the carbon footprint we save by just getting rid of desflurane in 1 year. And there's no change in patient outcomes. I presented this data to a lot of international meetings, and we published this data. And I'm happy to report in the last several months, with the help of other anesthetists who became very concerned, University Health Network in Toronto, the biggest health network in Canada, the Trillium Health Partnership, Women's College Hospital, and several other hospitals have joined Health Sciences North to dump destructive desflurane and protect our environment. The future goal of mine is to make Canada the very first country to ban desflurane or destructive desflurane. I think other countries will follow, and we can make a big impact. If you gather all the hospitals in the world and made that a country, it would be the 5th greatest release of greenhouse gases. So it's a very significant impact of healthcare, and removing desflurane can reduce about 4 to 5% of the carbon footprint of a hospital. Quite significant, quite disproportionately significant. Now, right now I'm relying on local initiatives, finding other tree huggers like myself in local hospitals. But then I realized that we could just use our existing carbon pricing in Canada. We currently price carbon $50 a ton. We price pollution. If we applied that to our greenhouse gases, we would essentially eliminate desflurane and make it non-competitive. So that's what I'm working with the environmental group Citizens Climate Lobby. I give a lot of these presentations to healthcare professionals, and one day one of my favorite pediatricians came to me and she said, well, Sanj, you found a gas you're using that was a very potent greenhouse gas and you don't need it. So, like, how difficult was that? I asked her to look into her own field. I was very happy when several months later I saw that she published in the Sudbury Star an article showing that puffers that we use to treat asthma and bronchitis also have a very high carbon footprint. And in most patients, they're no better than the powders or pills now. So that became her focus. But it doesn't just have to be healthcare professionals. We can all contribute. We approached local restaurateurs in the city, and they agreed to stop using plastic straws, styrofoam, and single-use plastics, and that dropped their carbon footprint significantly. I approached friends of mine who own major companies and storage firms, and they look at light management and optimization of their heating and ventilation systems. And that reduced their carbon footprint 30 to 40% and saved them money. You could be the person in the office who uses recycling and reusing, no more disposable cups, disposable pods, and find ways to reduce energy consumption. Every single person here tonight can make a difference. As an individual, you can reduce your burning of fossil fuels by your choices in your daily transportation, your vacations, or your heating and cooling needs. You can reduce red meat consumption, buy locally, vote for the climate, talk with people who don't get the crisis, or donate to environmental groups. Every single presenter tonight, including myself, is passionate about human health. But I wanted to remind every single one here in the audience that you can contribute to human global health by addressing climate change. Now I feel that I can look at that baby who was in utero in 2007 and I can tell her that, I did my best to try to protect her future in the ways I could. But a funny thing happened. Sometimes your actions have unintended consequences. While we were acting as citizen climate advocates, our baby who inspired us to make these changes became the internationally recognized and award-winning Sudbury's own Sophia Mathur, my daughter. I'm going to ask her to come up. You've seen her in Nature Things, you've seen her on IMAX, but most importantly, you've seen her at the corner at -3 degrees every Friday. So she's prepared this for us.
The voices of future grandchildren, I hear them asking, what were you doing? What have you done? What were you doing? What have you done? What were you doing? What have you done? What were you doing? What have you done?
Human health requires a healthy planet. Thank you very much.